All right, welcome to another episode of Awakening Your Fascia. One of the things we're going to talk about today is the sacrum, which is back here. I have my good friend Seymour here to help us demonstrate what we're looking at as far as what's often seen as SI joint dysfunction. And so the sacrum, let me just real briefly say, this is your sacrum, bottom of your spine, right? You got your cervical, thoracic, lumbar, sacral joint. At the sacrum, you have these two, your hips, and they connect right here at this line on either side. It's called the SI joint. And so oftentimes when there's tightness, whether it's in the back, okay, it's in these muscles, I'm going to show you with my band here. The back muscles can be tight and they end up pulling on one of the iliums, the hip bones, and it pulls it up out of alignment with your sacrum. When you have pain in the front of your hip, that can be a hip flexor, could be the psoas muscle that goes, way connects at the leg bone and then goes all the way through the hip and connects all the way into your mid-thoracic region. If that's tight, that also will pull your hip out of place, causing SI joint dysfunction. And so what we want to do today is I want to show you some things to help you release that tension, open up the hips in the back, which will help release a lot of tension in the front. So people who often do a lot of sitting and you're sitting a lot, the sacrum has to hold that weight in some way or another. So whether you're at your computer, maybe you're doing a lot of driving, when you sit down, the spine will start to collapse, and that's where the core often goes disengaged. So the sacrum holds a lot of that force that you're sitting down on. And so a lot of pain will be there. It could also be people, women who are pregnant or just had babies or even had babies in the past, because they also can have issues where the pelvis was not necessarily aligned after having the child. And so that might cause the SI joint dysfunction. All kinds of reasons why. What you want to know is, even though all those things have happened and they're important to understand your past so you don't repeat a lot of the things in the future, what the goal in fascial work is just get in there and start moving the tissue. Because guess what? Your body is always looking for what we call homeostasis, or feeling secure, feeling safe. And even when there's pain and your body's telling you, hey, help me, help me, help me, then guess what? You get to go in there, release the tissue, and all of a sudden you change a pattern. You open up a line of connection. So today what we're going to do is use these balls that we have here to help release some fascial tension in your hips, and I guarantee you will feel much better. All right, so as I mentioned, these are actually Franklin Method balls. We have them in the studio. We'll post a link of where you can purchase them if you're interested in getting some, or just go to Franklin Method. I'm sure you can find them as well. It's a great, they're not too hard. They're actually very soft, but they have some air, of course. And you can add air if you wanted to, but I wouldn't have you do that. I want the ball to give so that it's working with your tissue. One thing about props, so when you're doing a prop like any kind of, like maybe you have a foam roller, maybe last time, one of our past episodes, we did a towel. Any prop you want to use needs to be, would ask you to try it to be soft, something that gives into your tissues, into the muscle tension. If it's hard, and I know some people like really hard things, like there's a Theragun or maybe a hard foam roller, or some people even get a spoon and dig into the tissue because if they're that much in pain, your body will fight you because it's too much. Ultimately, we're looking to regulate your nervous system, help your tissue calm, and that will allow the tissue to eventually soften and open up. So that's why I'm using a ball like this that gives and will give into the tissue that I'm placing on top of it. All right, and just so you know, I'm working through some sacral iliac issues right now. My right sacrum is just a little off, and so I know I could use this work, and I know many people are having this issue as well, because we often say sitting is the new smoking. If you're sitting too long, you're gonna have some issues with your pelvis. So give this a try. So what we're gonna do is, I'm gonna lie down. I'm gonna take just one ball for now, all right, and I'm gonna place it underneath my hips, right in the middle. Okay, so I'll move my shirt all the way. So I'm placing it near the middle of my sacrum, not the tailbone, not to the bottom of the tailbone, not too close to my lower back. It's about the middle of my sacrum. And what it's doing is it's pushing the sacrum up just a little bit, allowing the two iliums, the two hips that I just showed you, to release on either side. So now I can get a feeling of my pelvis spreading across the back. And what I'm gonna do is I'm gonna wait for a minute. I'm gonna take some breaths here. And this is key, to give yourself time to breathe into the space that it's creating, to allow your back to settle. And the more my pelvis begins to soften around the ball, the more I can feel my sacrum relax and my lower back begin to drop towards the mat. And notice I'm not doing anything as far as any pelvic tilts or causing any motion at this time. I'm just being stable and still over the ball. But one more breath here. Whenever you're dealing with deep tissue tension, you got to give yourself time, because this is an area of deep holding. In fact, we call this one of those areas at the lower back is a gravity center. It's where we tend to hold a lot of our weight when we're walking through our day or carrying things. As I mentioned sitting earlier, it's a gravity center. So to interact with the gravity center means you have a lot of strength there that does not want to let go, and it won't let go very easily. So it's not like I'm gonna hurt myself. I'm just giving myself the time to settle in and allow those tissues to soften. As you're doing it, one more thing, you'll start to feel some releases. Maybe you'll feel your sacrum just hurt a little bit uncomfortably. Give it time. You know, a big conversation that we could have here is about how to understand your body's pain. You know, pain is a good indicator of that you want to address something. How you address it makes a difference. So if it's pain and you feel that you can't even touch the area at all without causing more pain, then yes, you want to go get that checked, do something that's gonna have somebody else help you work through that issue, whatever that may be, a doctor or physical therapist. Absolutely. Sometimes though, pain is something that it's asking you to just work into a little bit. So in our fascial practice that we're doing, myofascial release, I can go into this pain, this discomfort, for example, for me on my right side, and I'm using the pressure to help alleviate some of that pain or distribute it across the sacrum. When I say distribute it, I don't necessarily mean I want to cause more pain. I mean, it's actually dissipating the pain, and now my whole pelvis can open up. And now I can work more efficiently through the rest of my hips. So I just want to keep having you think about, don't shy away from pain, understand it, go into it, and let it inform you of how to best interact with it. I'm going to move slightly to my left because it's my right side which is bothering me, and so I'm going slightly to the left. Now I'm not on my butt cheek on the right. I'm still close to the center, just slightly to the right. So I'm on one of those joints that I showed you earlier, and I'm going to wait here. Just again, breathe. And this is a lot of waiting. Notice I'm not going into a bunch of stretches right now. One thing that we say here at the Pilates Center of Austin is stretching can help to open like a muscle line, like say my hamstring or my quadricep. It's not always going to necessarily lead to lasting healing. I may feel good for a time, but to really affect the problem, I want to get to the deep tissue tightness, or what I've referred to in the past as the straitjacket of something holding you. So I'm just waiting on where I'm slightly to the left. It's in the middle, just to the right of my sacrum, so on that joint. And right now, I'll tell you what I'm feeling is my right hip is starting to just spread out. I can feel some release on the right side. It actually affects my right hip as well, because this talks to I showed you earlier, the psoas muscle. So I can feel that releasing. So I'm gonna follow this release. I can really sense this opening up by letting my legs slide out. I even had to adjust my shoulders a little bit. So now my leg is long, while the ball is gently pushing my right SI up, and now my leg can release long. Now my, what's called my hip flexor and my quadricep muscle, even again my psoas is elongating in that direction while my pelvis is moving up, allowing my hips to spread on the mat, relax down on the mat. Take a few deep breaths. So I want to speak to you in a way that you're thinking as a whole body perspective. The SI dysfunction is not just an SI issue. There's always a top to bottom relationship, whether it's my leg or my ribs or maybe my arms. And the breathing really helps to kind of calm the whole system. Now I'm getting to the point where I can feel my leg get heavier towards the mat. So my sacrum is starting to let go, that right side. My right thigh and hip is starting to stretch a little more open. And now my right side of my back, my rib cage, is becoming more in contact with the mat. I feel more, get a more feeling of the mat against my back. And again, I want to emphasize the time that it takes to release. It's going to be up to each person. I'm not saying it's going to be 10 minutes for one or 20 minutes for the other. You want to give yourself the time that it takes for you to release. So it could be a little more, it could be a little less. Try to just listen for the tissue to respond. Now I can feel the tissue releasing around my glute now. My glutes now begin to open up. I'm going to move slightly to my left, just a little bit more. So now I'm having the ball be a little more directly on the inside of it's called the gluteus maximus muscle. And now that is pushing my hip a little more forward and allowing the front of my pelvis to release. And remember, you keep listening. Don't fall. I would not suggest falling asleep on this. It wouldn't necessarily be bad, but you would be too much, especially if you have a lot of discomfort. But you'll relax you, so you may want to. So if you feel yourself falling asleep, just move the ball out of the way and go to sleep. All right, so do one more release. I'm going to move one more time to my left. So now the ball is now directly inside my glute max muscle on this right side, off my sacrum completely. And my left hip is now falling towards the mat, which is fine. And of course, because the ball is pushing my right side up, my left side is dropping down. So now I can just allow that, let that happen. My pelvis is slightly turning or rotating to my left, which is not a big problem. In fact, if you have a sacral issue or SI joint dysfunction issue, usually the pelvis is so tight, your hips are not getting the natural rhythmic flow that you should have when you're walking, which is why it's causing more pain. So this is actually helping me find some rotation in my right hip to my left, and turning my hips to my left in a way that I can accept it without putting a lot of force. Okay, inhale again. And then exhale as I soften and release down. Okay, now we could stay there longer. For the purposes, I want to show you the progression. I don't just leave myself and think, okay, good, it's fixed now, because it's not. So I'm going to take the ball out. I'm going to just roll slightly onto my hip, keep my leg long for now. And the first thing I notice is I'm a lot heavier. Like my hips more in contact with the mat, my pelvis and my glute are a lot more flat into the mat. My leg is long. These are things you want to notice, because sometimes it's hard. It's hard to know, did it work? Am I going in the right direction? That's what you look for. Is the pelvis a little more flat? Is my leg a little longer on the mat? Are my ribs a little further down? And I can feel all those things. I'm going to bring my leg back in. And again, just comparing both now, actually now it feels even. My right and my left hip are now feel equally flat. Before I could feel a little like something was sticking out on the right side. Now it's flat. So first thing I'm gonna do to help me keep this position is just move through my hip sockets. It's called a hip dissociation. I want the pelvis to stay pretty much still while my legs are just kind of gliding within the hip socket. So now I'm doing something, this is called restorative movement. I'm restoring the movement that I had prior to that SI joint being inflamed or out of whack, or out of joint, that is. So just a little movement to the hip sockets. And inhale, open. Exhale, close. Inhale, open. Exhale, close. Now I'm going to go both knees in the same direction, and I'm going to go small at first. So I don't want my knees to fall to the floor. I'm going slightly to the right. Pause there, because here I can feel pressure on that right hip. So I'm just allowing the sacrum to settle and my legs to release. I'm going to come back to the middle slowly. So come back to the center of the sacrum. Inhale. Exhale, go over to the left. And notice this side goes easier to my left. It just, no problem. I go further, but that's all I need to do right now. Inhale, center. Exhale, over to the right again. There we go. So now it wants to go a little further each time. So now again, the leg just gliding through my hip socket, my pelvis. The left hip is coming up, and that's okay. I'm not letting it. I'm not trying to just roll. I'm still keeping that hip down as much as I comfortably can while allowing my legs to go that way. Come back to the middle one more time the other way. And I just release to that side. By the way, one way that this showed up for me that I knew was an SI issue is that my right foot has been bothering me a bit. So I've been doing a little more walking and running, and my right arch is a little sore. I wouldn't say it's like plantar fasciitis, but I know I have like a pulled ligament or tendon. So I'm just doing this. This is going to show me something's not off. Something is off. Not my right side is not working efficiently. All right, so now I'm coming back to the middle. All right, so now again, flat, both hips are grounded. Now I can throw in going into a small bridge. So I'm gonna press my feet into the mat, curl my tailbone up, so I'm tilting, and I can feel a nice smooth motion on each side of my SI joints. And then I'm gonna peel my spine off the mat. I don't wanna just pop up. A lot of times people do a bridge and they'll just push right up to the ceiling. And often what that does, that causes the glutes to fire too quickly. And then that tightness in the back that I showed you earlier is gonna pull on the hips. I'm looking more for the feeling of my tailbone going towards my knees and my hips opening to the ceiling and my chest widening. Inhale here, and then exhale, slowly come down. So now I can keep reaching my tailbone towards the knees, long waistline sacrum, and then drop down. And that just completely opened up the front of my pelvis too, because I'm not just gripping. I guess I want to say this again. I usually do bridges by people do bridges by squeezing their glutes, tightening their back, and just pushing up. There's a lot of that happens in your what we call the back chain, or all your spinal erectors and your glute muscles that can pull on your SI joint. What I want you to practice is relaxing, lengthening your back, lengthening your sacrum tailbone, and then coming up. So don't think squeeze your glutes. Doesn't mean they can't work, because you know what? They have to. This is called a hip extension exercise. So please don't get me wrong. The hips have to open in order for me to bridge, but we don't have to drive it from the glutes or the back tensing. So I'm gonna get longer. Inhale at the top. Exhale back down. And this is why it becomes more efficient. I want movement to be efficient, right? Effective. distributing my weight. I'm gonna bring my feet a little closer. I feel like I get a little more foot support, so I'm bringing my feet closer to my hips. Inhale, excuse me, inhale, exhale, come up one more time. Now I'm gonna add this. So since I know my right side had the issue, I wanna bring my center of weight and gravity towards my center to get my pelvic floor active, my low belly. So I'm gonna just gently, imagine I'm squeezing a ball, and I could put a ball between the knees to cue this gentle squeeze. But again, I'm not squeezing super hard. So this is not like you going to the gym and just squeezing all the legs together to get what they're called the adductors firing. I want just enough squeeze, but with reach. So now I get more of a hip opening and lengthen my spine. Now I feel all this energy, all this connection through my center. And how that's gonna help my sacrum relax, because now my butt's not doing all the push. Everything is distributing through my back, long, wide, to create lift. It actually feels really good. So we call that restorative movement. See, I'm restoring how my body can naturally function through my hips and then now eventually through my legs. So one more progression with that. So now you have a good, so we call this connecting from my feet to my pelvis. We call it the lower core. Now I'm gonna involve the upper body, my upper core. So now I'm gonna do a curl. Now by curl, the goal here is to not tense my back, but instead allow my pelvis to just feel weighted on the mat. So I already have the feeling of being flat. I'm gonna keep the pelvis flat. Inhale, lift my head. And then exhale, come forward. And as I come forward, I just wanna be just forward enough that I can still sense my pelvis down. Because again, if I go too high, my pelvis wanna pull up. And that creates tension in my hips. I want this to be just about the abdominal wall engaging while my pelvis stays down. Because guess what? Once my pelvis stays down, now I can add the legs coming up. So there's a progression. I want you to see there's a progression of how I'm creating internal support, inner thighs, pelvic floor, low belly, without over-engaging where my body wanted to, which was my back or my sacrum. Right, and do that one more time. So you can just keep seeing this whole progression. I'm lengthening the neck. Pelvis is now weighted and heavy. Inhale, lift my head. Exhale, come forward. With my hips grounded, I lift my legs. And just feel that connection. And then you release, and then come back down. All right, so now one more thing. If that bothered your back at all, and you're still, you can't lift the legs, they don't just float up. What's missing is the hips still maybe still trying to work or fire or engage. And remember, that's what happens. Every time there's pain, your muscles at that area are overcompensating. They're working too hard to help you with the rest of your movement. So we just released it. Want to keep it released and find other ways to create movement. In this case, we did the inner thighs and the low belly. So if that still happens and while you're trying it, then you can do this, just do one leg. Just do one leg and come from that same understanding, hips grounded, head heavy, just do one leg. And that is enough. I can feel my low belly engaging. I can still feel my sacrum spreading out on the mat. All right, now just to test, I'm gonna extend my legs long. So the way I kind of just check and see how my pelvis feels now, which again is fairly flat. I'm actually gonna do a small, I'm gonna flex my feet and press my heels into the mat. I'm not gonna lift my hips or anything off the mat. I'm just gonna feel pressure down. Now, the reason why I want to do that is when the SI is again, there's a dysfunction, usually the hamstrings are not doing their job, which means they're either tight and weak or they're just not firing. And that often happens with SI issues. So what I'm doing is I'm just gently pressing my right heel into the mat, and I can feel between my left and my right, I feel so much more easier connect with my left side. The right side is there, but I just have to like really pay attention. So I'm just pressing up, my feet are flexed, push the heel down, press, press, press. So now that's now I'm getting an energetic understanding, like a neuromuscular pattern development of when I stand up. That's what I want. Again, along with the inner thighs and the pelvic floor, my hamstrings are helping me stand tall. In this case, on the floor, I'm just standing on the imaginary floor here, but it's helping me find what I want to sense when I stand up. So I'm just pressing the right heel, and I'm doing like 10 to 20 times each side just to kind of really get that connection happening. All right, so let's test this. So I'm gonna roll up to standing. Okay, so now let's check. So what I'm gonna do is, I'm just gonna stand here and feel, okay, notice how the hips feel, notice how your feet feel, actually. Like what I notice right away is, my pelvis feels very relaxed and down. I feel weighted well into both feet, okay? So just walk around the room for a second. I'm just gonna walk back and forth. Just feel how you sense weight down into your feet. Can you feel kind of like a natural hip sway? Like there's a gentle movement of your pelvis side to side now. There's, you don't want to, if you feel locked up and the hip is still hanging back, often that's what happens with pain, is the pelvis will pull and then it's just stuck right there. I'm looking for a natural way that my pelvis just kind of moves through my walking gait. Feels good. Okay, and then the last thing I'll do, just to kind of always check in, I just do one reach up for the sky, extend the spine, dive down. If you can, touch the toes. If that's too much, just go where you can. And then I'm going to bend my knees, ground my feet, stack my spine, and then come up. So this is a great way to practice releasing your sacral pain. Start in the middle, move to the side. Do some exercise to help you reconnect. Stand up, walk around. If it doesn't work right away, try it again. All right, try that at home. We'd love to have you give us some feedback. Let us know any questions you have. Please like or subscribe. Hope you like our content, and we'll see you soon.